I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at a question of the week, and that question is, what should a transgender person disclose when they go to the emergency room? Most people don't like to go to the emergency room. We go there because we have to, and transgender people have often had bad experiences there with being misgendered, with having healthcare personnel ask awkward or ill-informed questions, having to teach the ER personnel about transgender medications, surgery, or anatomy. And some trans people have even experienced insults and violence directed at them in emergency rooms. So what information should you disclose when you go to the ER? Let's take a look at this in 3 simple points. It would be ideal if all people felt trusting enough to go to the ER, give their full medical history, and feel comfortable disclosing everything. And medically, that may be the best advice. But this may not always be safe, possible, or even necessary. Point number 1, there are many medical conditions where being transgender is simply a non-issue. Here are some examples: conjunctivitis or pink eye, ear infections, strep throat or sore throat, whiplash injuries, sprains, strains, or even fractures of your arms or legs, ingrown toenails, and on, and there are many conditions. Point number 2, if a condition could be impacted by the hormones you take, do give the medical facts. So here's an example of this. Supposing that you are having leg pain and swelling, shortness of breath, and pain with breathing. Now, this could possibly be a blood clot or DVT or deep venous thrombosis in your leg and an associated pulmonary embolism or PE in the lungs. And we are at a greater risk of these problems while taking estrogen. So tell your ER provider your whole medication list. Point number 3, any urinary condition, and particularly any post-operative genital condition, will require disclosure. If you have had a gender-affirming genital surgery, you likely have had your urethra surgically modified. So it is in your best interest to be prepared to explain your post-operative anatomy so that you can get the best care that you can. By the way, it's a good idea to have your surgeon's name and their phone number in your phone in case the ER doctor needs to consult them. The most important tip is this one: never allow any concerns about gender prevent you from getting the emergency care that you need. This could save your life. I hope this information has been helpful for you today. If so, please like this video and do subscribe to my channel. And if you have a question, please submit it in the comment section so that we can address it as a question of the week. Thanks for watching, and I'll see you in the next video.